the Prevention and Control Against COVID-19, the session 201. We have invited representatives of the government to give you the latest updates of the development of the pandemic and also take your questions. Present with us today, Vice Mayor of Shanghai, Madam Zong Ming, DG of the Municipal Health Commission, Mr. Wu Jinglei, Deputy DG of the Municipal Administration of Civil Affairs, Mr. Zheng Jun, Deputy DG of the Municipal Transportation Commission, Mr. Liu Bin, Captain of Traffic Policeman Team of the Shanghai Public Security Bureau, Mr. Xing Peiyi. First of all, I'd like to give the floor to Madam Zong Ming about the resumption of work and life. Friends of the media, good morning. First of all, I'd like to share with you the latest updates about the prevention and control of the pandemic in our city. After this recent outbreak, we have stuck to the policy of dynamic zeroing to stop the further transmission of the virus, to secure the life and health status of our people, with the coordinated efforts of all the population here. The daily newly added confirmed cases dropped to the double-digit number. Yesterday, we have newly reported 29 new confirmed cases. Lockdown population less than 200,000. We have successfully turned around the situation. We have to continue to face this huge task of bringing down the number of the daily newly confirmed cases and also the asymptomatic ones. We expect to see more collaboration from your side. According to our general action plan to gradually resume the normal work and life, since the 1st of June, we will enter into the third stage. That is to comprehensively restore the order of the normal life and work. Previously in Fengxian, Jinshan, Congming, 3 districts, we have carried out some pressure tests for the gradual resumption of work and life. And now, while respecting the baseline and ensuring the controllable risk, we will set up the permanent measures to control the further spread of the virus and also resume the normal order for work and life. I'd like to share with you several facts that you may be interested in. First of all, the control and prevention at community level. We have the permanent measures in place. We also have the tiered systems. If there's the report of the newly confirmed cases in certain areas, we will set up the medium risk region and also high risk regions, and also correspondent measures will also be installed. For people who are still living in the lockdown areas, you have to respect all the rules, you have to stay in-house, and there will be services delivered to your doorstep. Then for the lockdown areas during a period of 7 days, if there's no more escalating of the situation, then it will be downgraded to a controlled area. And for the controlled area, if for 3 days there is no newly added confirmed cases, it will be downgraded to a normal community. For the districts, villages, community commissions, as well as the property management companies, they should not use any pretexts and excuses to restrict the exiting and also the entry of their own residents against the law. And also, we have the posts of supervisors. We also have an early discovery mechanism. For example, the antigen test plus the nucleic acid test, and also the fever clinic plus pharmacy supervising system. With the shortest delay, we can discover suspicious cases. For people taking the public transportation, they have to have the negative result of nucleic acid test within 72 hours. For schools, factories, they have to report 0 case of fever patients. If there is abnormal situation, they have to immediately rush this person in question to the hospitals for the further diagnosis. Within the city, since the 1st of June, the ground transportation, rail transportation will be resumed in the whole network, and also for the ferries connecting the mainland area and also the islands, they will also be resumed. And we will put an end to the electronic certificate for the private vehicles. Ubers and taxis will be able to resume their services. For the other areas, except for the lockdown areas and controlled areas, private vehicles could hit the roads as they want. And we will continue with the checks of the negative result of the nucleic acid test. Since the 1st of June, we will resume basically the normal operation of the railway transportation so that we can facilitate the entry and exit of the city by the passengers through the railway transportation. We also have the consultation mechanism. We will also gradually resume the ferry transportation connecting Shanghai and other cities. We will also resume the aviation services between Shanghai and other cities. About the resumption of work and production, shopping malls, supermarkets, convenience shops, pharmacies, as well as the other commercial spots, they will gradually resume their offline services. Since the 1st of June, the maximum passenger flow will not exceed 75% of the normal level. We also encourage those commercial spots to carry out online rendezvous and appointments system. For the salons, for the haircut, and also for the beauty services, you should also make an appointment online. Postal services, as well as the other public services spots, will also gradually resume their offline services. And for the home appliances, cultural entertainment activities, as well as the sports venues, will gradually pick up their activities. A-level scenic sports will also be put on track, but we have the restrictions on the maximum flow of the visitors. For example, the flow should not exceed 75% of the maximum level of the capacity of reception of these sites. For the enclosed areas like the cinemas, we have to postpone their resumption of work. For the public parks, we will also reopen all of them in a staggered manner. For the resumption of classes since the 1st of June, while respecting all the rules for the epidemic control and prevention, for enterprises and industrial parks and also the buildings, we will gradually resume the work. The zero pandemic communities can gradually get their businesses back on track and also their life back to normal. And for the other enterprises, with the risk, they have to make sure that their employees will only travel from home to work. For the middle school and also elementary school, they have to continue with online lessons until the end of the semester. For the kindergarten and nurseries, young children should not go back to the school and campuses. While respecting all the strict measures, since the 1st of June, all the civil services will resume their operations, and also for the government authorities, except for their employees living in a controlled area and lockdown areas, the other remaining part of the employees can gradually go back to their working positions. We hope that our citizens in Shanghai will continue to understand our plan, and they also have to take measures to protect themselves, wear the masks, and respect the social distancing. They have to refrain from the gathering and also strengthen the self-monitoring of their health. At the same time, everyone should get themselves vaccinated, check their body temperature, and also scan the QR code for the health status. Dear citizens, let's join our hands and strive forward. Together, we can do a better job in the prevention and control against COVID-19 and gradually recover our economy, and together we can safeguard our homeland and our home city. Thank you very much for Madam Zong. Now I'd like to give the floor to Mr. Wu Jinglei to talk about the changes with the risk levels and also the measures in place. Dear friends, I'd like to give you the briefing about the current containment measures. Yesterday, we have newly added 9 confirmed cases and 22 asymptomatic local cases. Among the 9 newly confirmed cases, 7 discovered in the closed loop of the quarantine population, 2 developed from the asymptomatic cases. For the 22 asymptomatic cases, they are all discovered in a quarantine population. As of 24 o'clock yesterday, in designated hospitals, people in treatment, we have 86 severe cases and 28 medium risk cases. There's no domestic death case. As of 9 a.m. today, in total, we have investigated 0.96 million close contacts, all of them put into quarantine and supervision. And yesterday, we have got 189 people out of the hospital, and more than 1,000 people have accomplished their quarantine in collectivity, and they will get back to the community, and community commission will take the charge to take care of them. We will continue with the antigen test plus nucleic acid test as the total method for the screening. According to the screening results, as of yesterday, in total, we have 531 risk regions, about 190,000 people. And there are more than 1,000 controlled areas. And more than 22 million people are living in a prevention area, according to the joint prevention mechanism of the State Council, and according to the decision of the municipal leading group. For the Dapuqiao street of Huangpu district, it's becoming a low-risk area. In total, for the medium-risk region, we have 16 of them in the city. And one more thing to tell all of you, in order to better adapt to the changes of the fight against the COVID-19 and also respond to the needs of the people on a permanent basis, for example, nucleic acid test and antigen test, and also to lower the cost of the operation in a society and better safeguard the health status of the people. Since the 1st of June, in the public hospitals, the simple sample of nucleic acid tests, the price would be lowered from 25 yuan to 16 yuan. For one chip for multiple samples, the price would be lowered from 5 yuan per person to 3.5 yuan per person. Antigen test down from 15 to 6 yuan. For the permanent spots for the nucleic acid test, the free service will be maintained until the end of June. Thank you very much for your briefing, Mr. Wu. Now the floor is open for your questions. First, please identify yourself. The floor is open now. Line number 1, please. Thank you. With People's Daily, I have a question to Madam Zong. After resumption of work and life in Shanghai, how can you guarantee the permanent measures against COVID-19? How can you make sure the early discovery and settlement of the cases? Thank you very much. After the 1st of June, with this controllable risk in the city, we will apply permanent measures against COVID-19. We will stick to the policy of the dynamic zeroing, and we will continue to improve the 4 mechanisms, namely flexible discovery mechanism, effective settlement mechanism, and a dynamic management mechanism, and finally a autonomous self-management mechanism. We also have the full coordination coordination of regional and permanent containment measures, early warning discovery, and dynamic fight. The coordination between the fight against rebound and spillover, a coordination between economic development and recovery and COVID-19 containment. Considering the characteristics of the Omicron variant, which is latent and also widely and fast spread, we have to set up this mechanism of fast treatment and also the settlement. At different levels of the government, we will stay on guard. When we discover a new suspicious case, we will immediately mobilize the multiple authorities, for example, the Public Security Bureau, the Big Data Center, and also the local authority of industrialization and informationalization. Within 2 hours, we will dispatch the workers to the site of the discovery. Within 4 hours, we will have the test result, and also within 24 hours, we have to accomplish the epidemiological report and investigation. Between different stages, from the early discovery to the settlement to the diagnosis and epidemiological researches and investigation, we have to strengthen our coordination so that we can cut off the chains of further spreading of the virus. We have to stick to the bottom line of no significant and serious rebound of the cases. Line number 2 for the question, please. I'm from CGTN. Yesterday, we received the news that into and out of the residential compounds, it's already free pass. For the other personnels, for example, the delivery persons, what is the requirement for their entry and exit from the residential compounds? Yesterday, according to the Municipal Office of the Containment of COVID-19, since the 1st of June, except for the controlled area and lockdown areas, for the other residential compounds, we resumed the normal measures for the entry and exit from the residential compounds. This is a standard for the city. For any community authorities or commissions, they should not use any excuses to stop their residents from traveling into and out of the residences' communities. For the residents, they have to abide by the existing rules. First of all, they have to put on their masks and also check their body temperature. And second, they have to scan the QR code at the entry of their residential compounds and also demonstrate their green code for the health status. If there is the guardian by the entry, they could scan the code or they can demonstrate their QR code. For the elderly persons who don't have a smartphone, so who cannot demonstrate or scan the code, they can use the paper version of the code to go with them. One tip for you: for the recovered asymptomatic cases or confirmed cases, once they get back to the community and back to the residences, for the following up period of quarantine and also for the close contacts and close contacts of close contacts, when they go back to the residential compounds, community authorities should not block their path back to the home. For other people visiting the residential compounds and who are not living in the compounds, apart from the above-mentioned measures like the masks and also the QR code scanning, they also have to show a negative result of nucleic acid test within 72 hours. For the delivery man of merchandises and the takeout meals, we suggest a non-contact delivery method. And for the nurses and the other servicemen, for example, for the repairing of the home appliances, they have to get the approval of the owner of the properties first. For the above-mentioned measures, maybe they can create some inconveniences during your entry and exit from the residential compounds. However, they are a must and they are very necessary during the stage of development. I hope that you can understand. Next question, please. Line number 10, please. Thank you. I'm from the Liberation Journal. I have a question for Mr. Wu. Against this background of permanent measures against the COVID-19, when there is the positive case, how can we define the area of the lockdown zones? Since 0 o'clock, the 1st of June, we will apply the zoning policies for the low risk, medium risk, and high risk areas in the city. If in this area there's no control zone or lockdown zone, then it is a low risk area. For the medium risk and high risk areas, in principle, for the zoning of these medium risk and high risk areas, we will look at the buildings and community, villages, the compounds, and also the trajectory of the confirmed cases. At the same time, according to the results of the epidemiological studies, we can also consider a moderate extension of the area. In this region, if we have reported more than 10 confirmed cases of COVID within 14 days, or there are more than 2 clusters of positive cases, then this area would be defined as a high-risk area. If within 2 weeks there's the report of no more than 10 confirmed cases, or there's no more than 1 cluster of positive cases in this area, is called a medium-risk region. For the medium risk or high risk region, within 14 days after the classification, there's no more discovery of positive cases, confirmed cases, then they will be downgraded, they will be moved down in the ladder of the classification of risks. And after the classification of the medium risk and high risk, what are the measures in place? For the medium and high risk regions, we have 14 days of closed-off management. There's no exit out of the residential compounds by the residents, and there's also the services delivered to the doorstep. We also have the installation of services for nucleic acid test. For the environment trajectories related to the confirmed cases, we will continue with relevant measures. When necessary, we can also take other measures to carry out the screening in the surrounding areas, as well as the disinfection of the environment, and also the transfer of the people into the quarantine areas, or the restrictions of the public transportation. As is mentioned before, for the medium and high-risk regions, for the discovery of the very last confirmed case, and for the next 14 days, there's no further discovery of confirmed cases, then we can lower the risk classification. For the low-risk areas, if the residents have visited some public places like the supermarket, shopping mall, or if they want to take the public transportation, they still have to demonstrate a negative result of the nucleic acid test within 42 hours. Of course, all those measures in place will be modified and changed according to the latest requirements, judging the current status of development of COVID-19 in the city. Line number 13, please. Thank you. I'm with Shanghai People's Radio. I have a question for the representative from the Municipal Transportation Commission. What is the arrangement of the transportation? Will we resume the normal level of transportation? Yesterday, the headquarters of our city has already published a notice. Since the 1st of June, we will resume the public transportation. More details for you. In order to guarantee the visits and transportation of our citizens, we have this whole network of resumption of work, and we are restoring the normal order one step after another. Since the 1st of June, the civil transportation and transportation connecting Shanghai and other cities, we are gradually restoring the normal order. On the first stage, we will extend the waiting hours, and when it is necessary, we will gradually establish a strengthened capacity of services. We also have this dynamic modification of our plans until the final total resumption of the work. For the civil transportation, rail transportation is back to normal. For the first and last train, it's already back to normal calendar. And for the extension hours during the weekend, we have to postpone that resumption activity. For certain stops of the civil transportation, we have to wait for the removal of the makeshift hospital before resuming the work. Between Shanghai and Suzhou, we have to wait for further notice. For the ground transportation, in our network, we have gradually resumed all the transportation services, and we have already resumed the level compared to the normal days. For the peak hours, we will have to suspend the extra services. Buses will be resumed since the 1st of June. For the routes of buses, if they travel through a high-risk region, they will not stop within this region. And we have to consider the following periods to see whether we can resume the whole operation even within these regions. For the ferries, we will also gradually pick up the activities. And judging by the current development of the pandemic in our city, we will decide whether we can further extend our services. For the Uber and taxis, we resume the activities, but they will not pick up the passengers from the high-risk and medium-risk regions. For the key areas like railway stations and also the airport, we can also resume our activities. The co-biking services will be put back on track. We will also strengthen the management of the co-biking services. And for the parking lots, we can also strengthen our management. We will also disinfect all the co-bikes and also strengthen the transfer of those co-bikes to better facilitate the circulation. In Pudong and Hongqiao International Airports of Shanghai, we will gradually increase the number of aviation in the domestic area. In the railway station of Shanghai and Hongqiao, in the southern station of Shanghai and Jinshan station of the railway transportation, we will gradually increase the available trains in the Shanghai Xi, Shanghai White Station, and Anting White Station, Songjiang Station, Songjiang South Station, Jinshan North Station. Around the 20th of June, they will reopen the ticket office. For the ferry services and shipping services, we have to consider the destination cities opinions before reopening all of these services connecting Shanghai with other cities. Line number 23, please. I'm from Shanghai Education TV. I have a question for the traffic police team. Since the 1st of June, is it possible for the public transportation and also private vehicles to travel across the rivers? And for the highways, is there a requirement and restriction for the private vehicles to get on the highways? Thank you very much for this question, and it's a question asked again and again by the owners of the private vehicles. Yesterday, according to the publication of the notices, the article number 3 is about the circulation of the private vehicles. To better apply these rules, after 0 o'clock, the 1st of June, for the existing quarantine checkpoint, we will remove all the barriers by that checkpoint. By then, in the whole area of the city, the private vehicles could circulate freely, including traveling across the river. And also for the public transportation, they will also be resumed to normal level. And for the private vehicles with a non-Shanghai plate, they also have to follow the rules. For the private vehicles traveling through the highways, they have to be checked. For people leaving Shanghai, they have to show a negative result of nucleic acid test within 72 hours and also a negative result of the antigen test within 24 hours. People coming back to Shanghai, they also have to show the negative test of nucleic acid test. Because we are gradually restoring the order of public transportation, and through the media report, we are delivering the message to the owners of the private vehicles. We are sharing with them the tips and also some more education. First of all, before hitting the road, you have to check the status of your vehicle. Because your vehicles have been parked for a long period of time, if you don't check the status of your vehicle, then maybe you can run into some problems of your vehicle. Please check the pressure of the tires and also the gasoline level. Second, after hitting the road, you have to be very careful during the driving, because it's already been very long that you didn't touch the wheel. So maybe you have to take some time to get familiar again with this driving environment and driving habits. Especially, I'd like to suggest that everyone to, first of all, get the vibes back and get used to the road conditions before hitting the high-speed road and the highway. And finally, I suggest all of you to abide by the rules of public transportation and road circulation. Line number 16, please. And from the Xinmin Evening Post, a question for Mr. Wu Jinlei. For people delivering an abnormal result of the nucleic acid test, if they have ever visited the hospitals, what is the measure in response, and how can we guarantee a normal service in the hospitals? Thank you very much. This is a subject and issue of common concern. Hospitals are special places. Considering the current development of COVID-19, we have the confidence to turn over the tendency. For our normal work and life, we are getting the normal order back and we are putting things on the right track. Considering the recent development of the medical institutions and hospitals, we are resuming our services and it's gradually getting back to the normal level. For the institutions, while delivering the normal level of services, they also have to stay alert against the COVID-19 risks, because that is a precondition for the normal delivery of health services. If people with abnormal nucleic acid test results have already visited the hospitals, then immediately we can activate the emergency response mechanism. The hospitals, they will also gain more experiences during their daily practices. If we discover these above-mentioned cases, immediately hospitals will start the mechanism of the emergency evaluation. Within the shortest delay, we will put people in question into quarantine. We will report to the municipal CDC. We have the 2+4+24 to handle these cases. Epidemiological teams will arrive at the spot within 2 hours. Within 4 hours, they will conclude the latest updates, and within 24 hours, they will complete the report of epidemiological research and investigation. This is our 2+4+24 response mechanism. And if there is the above-mentioned emergency case for the CDC and hospitals, they will study the results of the epidemiological report and also make a very well-targeted zoning so that they can better handle the situation. While ensuring that the risk is under control, hospitals have to shorten the lockdown period or to narrow down the lockdown area so that we can minimize the impacts on the whole area. So if we need to lock down the area, we have to do it quickly, and we also have to do the screening very quickly. And we have to do the disinfection in the most effective manner. And finally, we also have to make sure that we have to reopen all the institutions as soon as possible when qualified. For the clinics of emergency and for ICU, and also for the fever clinics, and also for the maternity departments, if not necessary, we will not lock it down. In principle, if we do need to lock these departments down, then the lockdown periods will not exceed 2 days. So that is all those. That is the measures for the special circumstances and special departments. While applying the stringent measures for the prevention and control of COVID-19, we have to restore all the other departments, for example, the surgery, operas, theaters, and also the outpatient sections. We also have the appointment system online. You have asked how we can guarantee the normal services from the medical institutions. First of all, we will consider the level of appointments online and to strengthen the equipment of our personnel, because we are gradually getting back on track. And second, we also look at our existing procedures of the diagnosis and treatment, and we will also gradually improve this procedure of treatment. During these past days, we are improving our services. We are standardizing the whole procedure of diagnosis and treatments because they are of great importance of guarantee of the service quality. We will also consider the extension of working hours within hospitals. For example, we will extend the service hours in the morning session and in the evening session. You must have already noticed that we have the online consultation services. With the web services, you can have more access to the doctor's consultation. And we are also enriching the content of online consultation. We are making the services online better equipped and more accessible. In such context and circumstances, for our citizens, if you need to visit the hospital in person, you have to remember to scan the QR code in the place. And when you are visiting the hospitals, when you go inside the building, please don't forget to wear your mask and follow the instructions of the personnel in place so that everyone is contributing his or her part to the fight against the COVID-19. Together we can safeguard this environment and ensure the normal order of the delivery of medical services. I think that today we have this hard-won results of the fight against COVID-19. We have to protect and safeguard that victory. The final question for today, line number 8, please. Thank you. I'm from the Phoenix Media. I have a question for the Public Transportation Commission. Tomorrow we will resume all the public transportation services. What are the arrangements? And during the peak hours, early in the morning and late in the afternoon, people may be queuing for the scanning of the code. How can you settle that problem? Starting by tomorrow, civil transportation and transportation connecting Shanghai and other cities will be resumed. We urge all authorities to take relevant measures and prepare their personnel in advance. For the ferries, vehicles, and trains, we have already started the maintenance and also the disinfection. We also have carried out the stress test to make sure that all the wagons and also vehicles will be running in a normal way. We also guarantee that all the enabling conditions are in place. All the authorities should abide by the rules, and they will keep a close eye on the status of the environment, of transportation, and also their personnel. If there is a suspicious case, then we have this early discovery and early settlement mechanism. For the subway stations and bus stations, as well as for the stations for the ferries, we have the designated coding system. For each stop, we have a different QR code. Until now, for 18,000 buses, we have attached the code images to the vehicles. And for the 3 ferry stations, 37 bases, we have covered all of them with the code of workplaces. For some hubs of transportation, we have deployed the guardians of the transportation surveillance. For the peak hours, we have already elaborated the plans for people traveling with the ferries, subways, and also the ground transportation. We have made the instructions to guide them. For example, for the code, with their smartphones, people can enjoy the one code for all services. They have this quick pass. For people not using the smartphone to get by, the gateways, they can show also the result of their test and also their status, health status code. You can also visit the website of our commission online to have more details. And one more tip for all the citizens. Starting by tomorrow, if you take the subways and also the railway stations, the ferries, taxis, ground transportation, and Ubers, you have to continue with the permanent measures. Throughout the whole process, you have to wear your mask, and also you have to hold negative results of nucleic acid tests within 72 hours, and your body temperature should not go above 37.3 degrees Celsius. We sincerely hope that you can collaborate with all the personnel and also take the public transportation according to the instructions and rules. So altogether, we can safeguard our city and also the public transportation environment. That is all for today's press conference. If you have any other further questions, please contact the Information Bureau of our municipality. This is also the 19th press conference after the recent outbreak of pandemic. You have raised 450 questions. You have covered a lot. Sincere thank you to all of you. I also would like to say thank you to all of our personnel working on the backstage. Many of our workers have slept in the offices for more than 2 months, and starting by tomorrow, they can go back home. And also, I would like to say thank you to all the citizens for your sincere suggestions and also your critiques. All those are precious opinions and contributions because you have contributed to the improvement of our work with our press conference. Thank you very much for your comprehension and collaboration. Starting by tomorrow, we will not organize the press conference on a daily basis, but still through the media reports channels like the Shanghai release, we will give you the timely report about the fight against the COVID-19 in our cities. You can also have an access to the latest policies. Starting by tomorrow, it's a new chapter for our city. We've been looking forward to these new chapters since long, and these are hard-won results. We have to use our efforts and join our hands to safeguard our city. And that is all for today's press conference. Thank you again, and you've done a great job.